Hey folks, it's Matt with Homesteady Health Direct Primary Care. Today we are talking flu shots, and more precisely we are talking about when the ideal time is to get your flu shot. I feel like each year we see the marketing come out earlier and earlier in the summer. I like to think of it as the pumpkin spice of the healthcare industry. All of these companies are competing to try to get your dollars, in this case your insurance dollars, and they do that by being first to market. Now, is that the right time that you should be getting the flu shot? I don't think so. It takes about 2 weeks for you to build up an immunity from the flu shot, and it wears off in about 6 to 8 months, usually about 8 to 9% a month. So typically the flu season peaks around January, February, March, and by that time your immunity is not nearly what it was after you had the injection. So ideally I like to recommend taking it mid to late October. That way you're catching the early part of flu season when things are starting to float around the community, and you still have good immunity when it peaks in the winter. Now, I highly recommend the injection for the very, very young, very, very old, especially if you have comorbidities or other illness. Now, this is not the average cold. Everybody likes to label it the flu, but influenza actually kills people every year, especially if you have those risk factors. So it's very important that you protect yourself. Even if you don't, it's going to knock you out for a week. You're going to feel miserable. So I highly recommend doing it and targeting sort of mid to late October. Of course, contact your provider for specific advice that's unique to you, but that's a fairly typical recommendation I think you can bank on to maximize your immunity. Again, it's Matt with Homesteady Health Direct Primary Care. Give us a ring, 607-882-6001 if you have any other questions. Take care.